Fever during pregnancy. Is it just a minor issue or something which you need to worry about? Is there something which need to panic? Not all fevers in pregnancy are dangerous, and not all fevers in pregnancy are safe. Not all fevers are harmful, not all fevers are harmless. Hello, I am Dr. Rajat. I am a practicing gynecologist and I regularly manage my patients in pregnancy who come with fever. In this video, I'll tell you what are the causes of fever in pregnancy, what are the home remedies which you can apply during fever during pregnancy, which are the medicines which are safe for fever in pregnancy when you need to contact your doctor. And keep watching this video till the end. There is a bonus tip. Hello, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. Fever is very common. Approximately 1/3 of females in pregnancy get the fever at one point or the other in their pregnancy. First of all, many patients tell me, sir, I am having fever. You need to define what is fever. Just a feeling of whether your body is hot or just you put your hand on the forehead, that does not signify a fever. Fever, excuse me. Fever is something which you need to measure on a thermometer, and your normal body temperature is about 98.4 to 98.6 degrees Celsius. If on temperature, the body temperature is more than 99 degree Fahrenheit, then we call it as fever. So I would always advise all the females who are pregnant, if they are having fever, put the temperature either in the axilla or beneath the tongue and measure for about 1.5 minutes to look whether the fever is there or not. Just by saying, you cannot say that you are having fever. Fever is different, hyperthermia is different. There can be a mild fever, there can be a high grade fever. Mild fever are less than 100 degrees, and if it is more than 100 degrees, it is called as high grade fever. So what are the causes of fever in pregnancy? Everybody wants to know. See, in most of the cases, pregnancy, like I have said previously on various platforms, pregnancy is an immunocompromised condition. In pregnancy, the general immunity of the body becomes low, and that is a physiological mechanism God has made to accept the pregnancy, because in an embryo, the sperm part is the outside part. It is not from the female's own body. So body decreases its own immunity so that body can accept the pregnancy and pregnancy is not rejected. Because pregnancy is a immunocompromised condition, the normal non-pregnant women or normal people who otherwise won't get the infection, there are more chances of a pregnant woman getting infections. So which are the most common infections? It can be respiratory tract infection, it can be viral infection, it can be gastrointestinal GIT, stomach infection, or it can be urinary infection. Viral infection is very common, especially from the month of September to the month of March. There is a flu season. Almost everybody gets viral infection. And initial few days, there is malaise, there is weakness in body, the body ache is there, there is prostration, you feel weakness. And then a couple of days after this, there is fever, and then a couple of days after this, there can be a upper respiratory tract infection, there can be common cold, there can be throat infection. So these are all the flu symptoms. Second most common fever is gastrointestinal tract infection, GIT infection, stomach infection. It is very common in our practice. I always tell my patients there are 3 ways by which the GIT infection occurs. Either you are eating an outside food, the food made on the street vendors, the food made in the restaurants. We do not know how much hygiene precautions they do take. Then you take water from anywhere. Ideally, I believe in pregnancy, water should be boiled, cooled, and then drunk. Make a habit of taking your own water to wherever you are going, because again, even if it is a bottled water for all purposes, it decreases the TDS chemical impurities. But howsoever they may claim bottled water, I always believe even bottled water should be boiled and then cleaned and then drink. Even if you are having an RO at your home, I would prefer water should be boiled, cooled, and then drunk. There are 2 other ways by which the GI infection can occur. I am a firm believer that most of the females who have got long nails, the moment you scratch, there is an itch in your body and you scratch your skin, the dirt from the skin gets deposited beneath the nails, and this dirt goes into your mouth when you eat or when you prepare the food, and that can lead to infection. Why fever? And the other common causes of fever are urine infection, dengue, and typhoid. Typhoid, like I mentioned in my GI infection, typhoid is always caused from eating an adulterated food, and by adulteration I mean the infected food. If you are in the summer season, if you have kept something outside the fridge for about 6, 8, 10 hours, that may get stale, that may get rotten, and if you accidentally happen to eat that food, you may get infection. That can also happen if you eat outside street vendors food, restaurants food, because again we do not know the hygiene levels, the water they are using, because it is a food and a waterborne disease. Urine infection is also very common in pregnancy because hydration levels are very low. Urine infection can be prevented by taking about 3 to 3.5 liters of liquids per day. Dengue especially occurs post monsoon. Everybody knows it is because of the bite of the mosquito. So those things we have to get investigated in the laboratory. But common things first. What are the home remedies you can take for fever? See, fever is associated with associated symptoms. There can be headache, there can be body ache, there can be weakness, there is dehydration, because the moment there is fever, the body temperature goes up, there is a more fluid loss from your body. You don't feel like doing anything, and after 1 or 2 days after fever, there is a localization. By localization, I mean that if the fever is because of a respiratory tract infection, then either you will have common cold, running nose, or you will have sore throat. If the fever is because of gastrointestinal tract infection, there may or may not be symptoms. Mostly in gastrointestinal tract infections or typhoid, there is either vomiting or abdominal pain or diarrhea, either vomiting plus abdominal pain, vomiting plus diarrhea, or there may not be any other symptoms. There may be a vague abdominal pain. In dengue it is called as a break bone fever. There are pain in joints and it pains severely apart from the fever. Otherwise, there are no other classical symptoms of fever. So you are having a fever, you have jotted down the fever on your thermometer and you visit. There is no point at that point of time, you cannot visit a doctor. So what are the home remedies you can do? First and foremost thing in fever as a home remedy you should do is drink plenty of water. You should maintain your hydration. You can drink plain water, you can drink coconut water, you can drink lime water, you can drink chas. I don't advise fruit juices. You can have ORS if you like, you can have milk if you like, you can have tea if you like, you can have ginger tea, you can have lemon tea, but hydration, you can have soups, but hydration level should be maintained, because like I mentioned, there is increased amount of dehydration from your body, so that hydration is very, very important. Next thing you do is cold water sponging, cold cloth compress. Water should not be ice cold, but it should be relatively cool water. Dip a towel or a handkerchief inside the towel and then rinse your body with the cold water. What that does is, because your body is already hot, the moment you put a room temperature or a cold water, not ice water, again I am reinforcing, not ice water. If you just swipe and wipe your body with cold water, because of that heat, the water will get evaporated and your body temperature would come down. You can also take a shower in a normal room temperature water, but avoid hot water. You will feel shivering, you will feel cold, but avoid getting into the blankets, because blanket will trap the heat inside the body and it will still increase your temperature. Next, everybody knows a paracetamol tablet, crocin, or a dolo 650 tablet. This is the absolutely harmless tablet. It can be, it should be, it must be taken, and we will get relief within 45 minutes to 50 minutes after taking the tablet. But don't just sit after taking the tablet. You can repeat this tablet 2 times a day or 3 times a day maximum. If still the fever persists, then please visit the doctor. Most of people in my OPD, when I tell them, they call me on phone, they WhatsApp me, sir, I am having fever. I tell them, please take crocin 500 or dolo 650. They come and tell me afterwards that we took only half a tablet, because otherwise the tablet full dose would have been harmful. I am a doctor, I know what I am telling. 500 milligram is the minimum dose for an adult to take, and if you are above 60-65 kg, you can have 650 milligram paracetamol also. It would not help, it would not harm. On the contrary, if you are taking half dose, either 250 or 325 milligram, the desired benefit of the paracetamol tablet may not be there. So please take full paracetamol tablet. You can repeat the tablet for 3 times, even 4 times a day you can repeat. But if you need to take, if the fever subsides after taking a single tablet, it does not recur after 24 hours or 1-2 days, then you do not need to take dolo 650 or paracetamol crocin 500 again. But if you need to take, fever is coming again after 6 hours, again after 8 hours, and you need to take it again and again, that means that there is some sort of an infective foci in the body and you need to visit a doctor. Please do not take tablet ibuprofen or tablet combiflam in pregnancy. Combiflam or ibuprofen tablet is contraindicated in pregnancy. It is not given in pregnancy. It can be harmful in pregnancy. For fever, combiflam or ibuprofen tablet is not given. Maximum, like I said, you can do cold water compress, tablet Dolo 650 and you'll be fine within 1 hour. The moment you are having more episodes of fever, you need to visit a doctor. What I do if a patient with fever comes to me? First of all, I try and elicit the symptoms. Either there is abdominal pain, a lower abdominal pain, a burning micturition, a sore throat, throat pain, problem, the hoarseness of voice, or common cold, or there is generalized weakness in the body. So if there is a clear-cut sore throat, sardi, khansi, tav, then we give a simple antibiotic, either azithromycin or augmentin, depending upon the symptoms. If there is an abdominal infection, lower, if there is no common, no pain in throat, no common cold, but there is vague abdominal pain or lower abdominal pain, then it can be because of either the gastrointestinal infection or it can be because of urinary tract infection. We can start with cephalosporin group of antibiotics, oral tablet, ask patient to take plenty of liquids orally. And we ask patient to come after 3 days. The effect of antibiotic starts coming after 48 to 72 hours. Now, most of the people, what they do is once the effect of antibiotic comes after 48 to 72 hours, they stop taking antibiotic. This is an absolutely wrong thing to do. I personally believe that if doctor has given you antibiotic for, say in my case azithromycin, I give for 3 days or 5 days. If I have given for 5 days, please complete the course for 5 days. Mostly for urine infection, the antibiotic is given for 7 days, but like I mentioned, the effect of antibiotic occurs in about 72 hours and almost 90% patients feel better after 72 hours. And unfortunate part of India is that in patients, they stop taking antibiotic. Now you will be well this time if we stop taking antibiotic, but antibiotic has to be, the course has to be completed. There is a pharmacodynamic reason behind it. If there is an infection in the body, the moment you start taking the antibiotic, the full action of the antibiotic starts occurring after about 48 hours. But antibiotic initially suppresses the infection, but it does not kill all the bacteria. For antibiotic to kill all the bacteria, you need to complete the course of the antibiotic, and sometimes the course of an antibiotic, especially in a urinary infection, may run for about 14 days, for 21 days also. That is to prevent the recurrence. If you take half dose of antibiotic or if you stop taking antibiotic after your symptoms are normal, you may end up in the resistance to that antibiotic. Not only you may end up to the resistance, you are spreading the resistance throughout the world. And that is the reason why the normal routine antibiotics are not working nowadays. It is problem of most of the physicians who are giving antibiotics for only 2 days, 3 days. Mostly the patients stop taking antibiotics once their symptoms are normal. Either they take half dose or, like I said, if there is a boil, if there is a tooth pain, I have given an augmentin. Augmentin is such a wonderful antibiotic. Usually within 1, 2 or 3 tablets the symptoms get resolved, but the course of antibiotic is there for 5 days. People do not take that, complete that course, and that particular person becomes resistant to that particular antibiotic, and in future if there is same kind of infection, then the chances that that particular antibiotic would have a good effect or a better effect would decrease. So my sincere request to all is, if your doctor has prescribed antibiotic for 5 days, please complete the antibiotic course. If your doctor has prescribed antibiotic for 7 days, please complete that 7 days course. Doctor must have written with something in mind, so please complete that antibiotic course. Now what happens in, sometimes there is a gastrointestinal infection or a typhoid or a dengue. Patient has vomiting, patient has diarrhea, and patient is not able to take anything by mouth. So in those cases, we cannot give the tablets, because the moment we give the tablets, patient would vomit that out. So what we do is, we give an injectable antibiotic. This injectable antibiotic we give along with IV fluids, because like patient is vomiting, patient is having diarrhea, so patient is having dehydration also. So by giving IV fluids, by giving injectable antibiotics, we are taking care of the infection, we are taking care of the dehydration. And if patient is having both vomiting and diarrhea, we ask patient to not take anything by mouth, especially food, for at least 12 to 24 hours. Allow the action of antibiotic to start. In most of the cases, within a single dose, antibiotic action does not start, but after giving second dose after 12 hours, there is a 20 to 30% relief in symptoms. After 48 hours, there is approximately 50 to 70% relief of the symptoms. After 72 hours, there is almost 90% relief of the symptoms, and both vomiting is also resolved and Diarrhea is also resolved. Along with that, we give symptomatic treatment for vomiting. We give symptomatic treatment for diarrhea in form of injectables or tablets. But we need, once we have given the injectable antibiotics for about 2 or 3 days, then we need to complete for next 4 to 7 days the oral antibiotic. For respiratory tract infection, a simple azithromycin course works wonders in most of the cases. Problem is most of the people abuse that prescription. If they have got a single time infection, repeat next time. Also, they have got upper respiratory tract infection, they would not come to a doctor, they would directly go to a chemist, take an azithromycin. But believe me, before prescribing the medicines, we have to clinically examine the patient. Along with an azithromycin, we also have to give some symptomatic treatment. We have to advise certain lifestyle modifications. Like if the patient is having fever because of the upper respiratory tract infection, viral infection, first thing I advise is hot water, salt water gargles 3 to 4 times a day, steam inhalation 3 to 4 times a day, hot liquids, whether it is tea, coffee, hot lemon water, soup, there should be plenty of hot liquid sipping throughout the day. These things work wonders. While a chemist may just give you the medicine, a doctor would examine you clinically, would explain the home managements, home remedies along with the medicines, would explain when the medicine would work, when the likelihood is that you should come back again. So my approach to a patient is, whenever a patient comes to me for first episode of fever on the one day, I said just take simple paracetamol 3 times a day, wait for a couple of days. If still the fever is persisting, then mostly there would be a localization of the symptoms. Either it is a respiratory tract localization or a sore throat localization or a GI localization or a burning maculation or bone pain. If localization is there, I may give antibiotic according to the localization. In case of respiratory tract, I may give azithromycin. In case of abdominal pain, I may give either cefixime or cephalosporins group of antibiotic. Same with urinary tract infection. In pregnancy, we do not give Norflox or other group of antibiotics. We give only plain cefixime group of antibiotics and ask the patient to wait for 3 days. If patient is having diarrhea and vomiting, we may start injectables because the oral tablets won't work. Still after 3 days of antibiotic, if patient is not resolved of fever, then I go for blood investigations. Now, textbook says that you need to go for blood investigations. You need to go for blood investigations as soon as possible. But I wait because in 90% of the cases, after giving the antibiotics, based on the symptoms resolve. That is fine. Which are the blood investigations we do? We do a simple complete blood count. We do a CRP to know what is the level of infection. And we do peripheral smear. We do a typhoid test. If the dengue season is going on, we do a dengue test also. And in India, like I always say, malaria is always to be ruled out. There is no blood test for gastrointestinal tract infection. There are symptoms, and if the infection is severe, maybe we can get an ultrasound done. But if CBC is high, there is more neutrophils, that would suggest to me that there is a bacterial infection. If CBC is on the lower side, total counts are low, instead of neutrophils, lymphocytes are more, that would suggest to me that there is a viral infection. Why CBC is important? So that I can also know the platelet counts. Immediately doing blood test may not always tell me whether the patient is having dengue. Sometimes dengue in the initial part, dengue test may come negative. Even the typhoid may come negative. So we do not always rely on blood test. We more often rely on our clinical judgment on the symptomatology of the patient and these kind of things. Yes, dengue, we can do dengue NS1 antigen, we can do IgG, IgM, but NS1 antigen comes positive first, IgG, IgM antibody comes positive later. Even typhoid, the antibody test which we normally routinely do, it comes positive in the second week. We do not know when the infective episode may have occurred. But like I said, treatment is usually the same for dengue. Unless the platelet counts are decreased, the dengue treatment is hydration, antibiotic if there is a secondary bacterial infection, and plenty of rest. We do not need to go for hi-fi investigations. We do not need to go for hi-fi ultrasounds for a simple fever in pregnancy. But before I conclude the video, let me tell you why fever is important. In 90% of the cases, the fever is a harmless entity. Fever can be managed at home with simple home remedies and a simple paracetamol tablet. Most of the cases, there may be a sunstroke, may be leading a fever. In those cases, you just need hydration, cold compress, and rest. Sometimes there may be a fever because of just a weakness kind of thing. You can take a simple paracetamol tablet, you won't need to take it again. If it is because of simple mild GI infection, mild respiratory infection, it can be taken care of by antibiotic. But sometimes fever may be dangerous. Fever may harm the baby. Fever is a reaction of a body to an invading antigen, and body is fighting that antigen, and during that fight the cytokines are released, the prostaglandins are released, and that causes fever. So never take fever lightly. If there is a persistent fever, that means that body is fighting hard, and that persistent fever, if it is there in early pregnancy, that may lead to a miscarriage. If it is in the mid pregnancy or late pregnancy, it may lead to an incidence of preterm labor or a premature rupture of membranes. So fever should not be taken lightly. The moment, just wait for a maximum wait for a day. If after taking paracetamol you need to take repeat doses of paracetamol 6 hourly or 8 hourly, visit your doctor as soon as possible. I hope in this video I have clarified most of your queries related to the fever. Please like the video, please share the video, and please subscribe to our channel. Namaskar. Bye bye.